Welcome. This is the second part of the BHSA Integrated Plan Budget Sheet video guide. In the first part video, we just finished off going over the BHSA Transfers tab. Let's now pick up where we left off with the Housing Interventions tab. The fifth sheet, titled Housing Interventions, captures detailed expenditure projections for housing intervention activities under BHSA. Per Welfare and Institutions Code Section 5892, 30% of BHSA funds distributed to counties shall be used for housing interventions. The first row to report asks for total estimated housing interventions funding received. Counties will input the estimated total housing intervention component allocation received for each year. Moving down the sheet, the next major section is where counties will report projected expenditures for housing interventions. These expenditures are split across two funding types: 1. BHSA funding only, and 2. All other funding sources, including Medi-Cal or local general funds. Just a quick reminder, the other funding sources columns on each of the component sheets, like the Housing Intervention, FSP, and BHSS tabs, are only meant to show additional funding for programs that already receive BHSA dollars. If a program is entirely funded with non-BHSA sources, like realignment, FFP, or federal grants, and doesn't receive any BHSA funding at all, it shouldn't be included on those tabs. Instead, those fully non-BHSA funded programs should be captured on the Behavioral Health Continuum of Care tab. Each funding section is further segmented by fiscal year, so you'll be entering Year 1, Year 2, and Year 3 projections separately. This ensures alignment with the 3-year integrated plan cycle. Within each fiscal year, you'll see that services and programs are divided into two delivery types: non-time-limited permanent housing settings, such as permanent supportive housing or long-term rental subsidies, and time-limited interim settings, which could include transitional housing, interim placements, or recuperative care beds. These categories align with the policy outlined in the BHSA Policy Manual and help DHCS understand how counties are balancing long-term housing solutions with short-term supports. The workbook provides predefined line items within each housing setting to help counties clearly organize their spending. After entering expenditures for all applicable activities across all 3 years, the sheet auto-calculates subtotals for each housing setting and fiscal year. This helps counties verify internal totals and ensures consistency when reviewed at the state level. Following the auto-populated calculations from entries above, this sheet also has a validation check. For this section, statute states that there should be no more than 25% of housing interventions funds used for capital development, and requires that 50% of housing interventions funds shall be used for housing interventions for persons who are chronically homeless, with a focus on those in encampments. Let's take a look and observe how the validation checks will operate. As mentioned, housing interventions must not exceed 25% used for capital developments, and at least 50% of housing intervention funds must be used for the chronically homeless population. For reference, we will go over Year 1 entries with simple numbers. Let's say that for Year 1, in column C, cell C35, you have $100,000 of total estimated housing interventions funding received. Of that amount, you are allocating $75,000 to capital development projects in cell C53. Notice that the validation check will highlight cell C67 in red due to it being out of compliance. In order for the validation to be accepted and populate in green, you need to ensure that the allocated amount to capital development projects in Year 1 does not exceed the 25% cap. Therefore, the entry should be $25,000 or less. Let's try inputting $15,000 for capital development instead. See now that the validation check now accepts the entry and populates the cell in green. The same validation check will occur for the 50% fund allocation requirement for the chronically homeless. Let's say that for Year 1, out of the $100,000 of funds, you are only allocating $30,000 to the chronically homeless in cell C61. Due to this, not meeting the 50% requirement, it will prompt a message saying, "This amount is less than the required 50%. Are you sure you want to continue?" Additionally, the validation check will highlight cell C68 in red. Should you enter an amount that meets statutory requirements, such as reporting $60,000 of funds out of the $100,000 of total funds for the chronically homeless, this will pass the validation check, and cell C68 will now populate in green. Again, please follow statutory guidelines and be sure to adjust your data entries accordingly should you see any of the validation messages pop up. The next sheet, titled Full Service Partnership, captures the total estimated FSP component funding, which should reflect the BHSA share allocated to FSP. Per Welfare and Institutions Code Section 5892, 35% of BHSA funds distributed to counties shall be used for full-service partnerships. The first row to report asks for total estimated full-service partnership funding received. Counties input the estimated total FSP component allocation received for each year. Next, we move into the core of the worksheet, which captures projected expenditures by FSP program type and funding source. The layout is organized in 3 vertical segments, one for each fiscal year: Year 1, Year 2, Year 3. Within each fiscal year, you'll report expenditures from 3 funding types: 1. BHSA funding only, 2. Federal financial participation, and 3. All other funding sources, including Medi-Cal and other federal or local contributions. For each fiscal year and funding type, counties will distribute funds across the FSP program models. These categories reflect the state's expectation that counties support evidence-based, community-integrated models of care. For each funding category and year, the worksheet calculates a subtotal of all FSP expenditures, which rolls up to help verify funding consistency and ensure counties are using their allocated FSP dollars as intended. These subtotal rows are not editable and auto-populated. The final section requests estimated unduplicated counts of individuals to be served by FSP each fiscal year. The next sheet, titled BHSS, captures the county's projected use of BHSA funds to provide community-based behavioral health services outside of FSP and housing interventions. BHSS is meant to support comprehensive, community-based behavioral health care for individuals with mental health and substance use disorders. Its focus is on delivering a range of services and supports that promote recovery, stability, and improved quality of life. Per Welfare and Institutions Code Section 5892, 35% of BHSA funds distributed to counties shall be used for BHSS. The first row to report asks for total BHSS funding received. Counties will input the total estimated BHSS component allocation received for each year. Just below that, we move into the main reporting table, where counties will project BHSS expenditures across the 3 years of the integrated plan. You'll complete this table for each of the 3 fiscal years and for 3 different funding sources, just as we did in the last sheet. For each year and funding stream, you'll enter projected expenditures under the following program service categories listed here. The worksheet will automatically calculate subtotals for each fiscal year and funding stream. These totals will then roll into the BHSA summary sheet and help ensure your BHSS plan remains consistent with the transfer decisions you made earlier in Tab 4. In the next section, BHSS validation, counties must report 2 critical metrics. 1, the proportion of BHSS expenditures that are going toward early intervention services, and 2, the percentage of early intervention dollars focused specifically on youth ages 25 and younger. Per Welfare and Institutions Code Section 5892, it states counties shall utilize at least 51% of BHSS funding for early intervention programs. Additionally, it also states that at least 51% of funds allocated for early intervention programs must serve individuals 25 years of age and younger. If a county enters values that do not meet those requirements, the workbook will prompt your entry with a validation message that your entry is not within the required allocated amounts. Let's take a look at a simple example of validation for column C, cell C48. Let's say, for example, your total estimated BHSS funding for year 1 was $50,000. Now let's say that you are only allocating $10,000 of that to early intervention expenditures in cell C29. This is not in line with the required 51% that should be allocated for early intervention. Entering this amount should prompt us with an error message. See the message. It reads, at least 51% of BHSS funding must be used for early intervention. Are you sure you want to continue? Validation error messages like this will appear and affirm your entries if it is not within the required policy guidelines. The validation cells will also populate in a red color. Let us now try inputting an amount that is within the required 51% early intervention allotment. Let's say you are allocating $30,000 to early intervention. See how the validation cells are now reported in green. For cell C49, the validation will check that at least 51% of funds allocated for early intervention programs must serve individuals 25 years of age and younger. The same rules apply should you enter in an amount that does not meet the statutory requirement. Let's say you are allocating only $10,000 of the early intervention funds for individuals 25 and younger. This will prompt the error message, and the cell 49 will highlight in red. Should you enter in $20,000, which meets the 51% threshold requirement, the validation for the cell will turn green. Please keep in mind the statutory requirements for how your funds are allocated and reported accordingly. We're now looking at Table 8, BHSA Plan Administration, which captures the total projected administrative and planning expenditures that counties anticipate needing to support the implementation and monitoring of the integrated plan. This table is split into two sections: Integrated Plan Administration and Monitoring, and Administrative Information Validation. In the first three rows, counties are asked to report spending by fiscal year across three key categories. Row 30, Total Projected Improvement and Monitoring Expenditures. Row 31, Total Projected County Integrated Plan Annual Planning Expenditures. Row 32, New and Ongoing Administrative Costs. Please note, there are statutory guidelines relevant here. For Row 30, under Welfare and Institutions Code Section 5892E2B, the total amount entered shall equal 2% or less of total projected annual revenues of the Local Behavioral Health Services Fund for counties with a population over 200,000, or 4% of the total projected annual revenues of the Local Behavioral Health Services Fund for counties with a population of less than 200,000. For Row 31, this amount shall be 5% or less of total projected annual revenues of the Local Behavioral Health Services Fund. The amounts entered here will be validated in the bottom rows. Now let's take a look at the validation section just below. Row 35 reports on improvement and monitoring expenditures divided by the total BHSA revenue. This auto-calculates the improvement monitoring share and ensures that it is a reasonable portion of the overall administrative activity reported. Row 36 reports planning expenditures divided by the total BHSA revenue. This row helps DHCS assess how much the county is spending on plan development versus performance management. Row 35 links back to Row 30, and Row 36 links back to Row 31. Row 34 reports total projected annual revenues. This is pre-populated by DHCS based on the county's estimated BHSA funding. It forms the denominator for all percentage checks. For this particular scenario, however, we will input an allocation amount value so that we can observe how the validation checks will operate. Let's say that we are a large county with a population over 200,000, and in year 1, we received a Behavioral Health Service Fund allocation amount of $100,000. For the projected improvement and monitoring expenditures in Row 30, we will report $2,000. And for the annual planning expenditures in Row 31, we will report $6,000. Now see the validation results in rows 35 and 36. The validation for the expenditures on improvement and monitoring in row 35 is accepted with the green cell. Our input of $2,000 expenditures out of the total revenue of $100,000 was within the 2% cap. However, our validation for the expenditures on planning expenditures in row 36 was not accepted and populated the red cell. This is because our input of $6,000 of planning expenditures out of the total revenue of $100,000 for year 1 exceeded the 5% cap on planning expenditures. Again, similar to the previous sheets, please keep in mind the statutory requirements for how your funds are allocated and reported accordingly. Let's now walk through Table 9, Estimated Local Prudent Reserve Balance. This table is used to calculate whether a county's prudent reserve has exceeded the statutory maximum and ensures any excess is fully reallocated into BHSA program components. All cells on this tab will be auto-populated with data entered in the previous tabs. The auto-validation check will check and ensure that counties have reallocated 100% of their excess prudent reserve funds and that it aligns with the total prudent reserve funds being transferred into or out of the reserve and the components. The last sheet of the workbook is the BHSA summary sheet. It is a read-only summary table that compiles and auto-calculates key data points from the rest of the Integrated Plan Budget workbook. Let's take a closer look. Again, this worksheet is auto-populated and should not be manually edited. It functions as a final roll-up of your component allocations, funding sources, and estimated expenditures for each of the 3 Integrated Plan years. The table is split into the 3 component columns: housing interventions, full-service partnerships, and behavioral health services and supports. A 4th column totals all activity across components for each year. For each year, the section begins with estimated unspent funds from prior fiscal years. This includes any carry-forward MHSA funds transitioned into BHSA from Tab 4. This amount pulls the sum of rows 46 from Tab 4 BHSA transfers, which reports on the total unspent MHSA funding that will be transferred to each of the BHSA component allocations, and rows 37 from Tab 3 Total County BH Expenditures, which reports on the total dollar amount of all projected unspent BHSA funds for each plan year. The next line is Estimated Year Component Allocations. These are your total BHSA allocations from the component allocation sheet. These values are pulled from rows 23, 24, and 25 above and pertaining to which component and year. These rows will populate data pulled from each of the relevant component sheets for the relevant years. The next line is Transfers into and from the prudent reserve. These rows show any funds you're moving into or out of the reserve. These values are also pulled from the transfer in and transfer out of prudent reserve sections of each component sheet. Following that is the estimated total available funding for the reporting year. This is your total funding available for the year, including new allocations and unspent prior year funds, which is calculated by the sum of the rows above. The final line for each year will show the estimated total year-end expenditures for each of the components, which is again pulled from the relevant component tabs for the relevant years. This roll-up provides a clear picture of how counties are phasing and pacing their BHSA spending across all 3 years. This tab should align with your entries across all of the previous tabs in the budget workbook. For more information and resources regarding BHSA policy and reporting requirements, please see the DHCS County Policy Manual webpage and its resources located at https://policy-manual.mes.dhcs.ca.gov. This concludes our video training guide for the Integrated Plan Budget Sheet. Thank you.